It is my pleasure to introduce our practice in focus this month, Smilow Cancer Hospital at Yale, New Haven. Representing Smilow is Howard Cohen and Sam Abdelghani. Howard and Sam will speak a little bit about their practice. Gentlemen.
Let me just very briefly tell you about the program that we have here. The Smilow Cancer Hospital at Yale New Haven is part of the 1,541-bed Yale New Haven Hospital Academic Medical Center. Smilow Cancer Hospital has 168 inpatient beds, about 160 infusion chairs. We are a National Cancer Institute, NCI designated cancer hospital. We are also an NCCN member institution. We also are certified as an ASCO COPE certified institution. The Smilow Cancer Hospital also has 13 cancer care centers located throughout Connecticut. And the goal of that was really to create a network of cancer care centers to allow patients to be treated closer to home. Our goal is that we recognize patients don't like to come to the academic medical center, and allowing patients to receive their therapies closer to home has been a patient satisfier. We also have cancer programs in 4 community hospitals that we support also. We are an affiliation with Yale University. We also do have a specialty pharmacy that handles all of our oral chemotherapy prescriptions. We also are a large investigational drug program here. We have about 450 open clinical trials. We basically have active phase 1, 2, and 3 research programs. As far as the Department of Oncology Pharmacy goes, we have about 135 full-time employees made up of about 72 clinical pharmacists, of which 80% are board certified. 50 certified pharmacy technicians, and these are very highly trained technicians. We do have a large residency program. We have 4 PGY2 oncology residents. This is an ASHP accredited residency program. We have a large medication assistance program. We have 8 medication assistance coordinators providing drug replacement, copay assistance, and waste replacement to our patients and to the hospital. We also have a pharmacoeconomic specialist as part of our oncology pharmacy team, who's not a pharmacist. She's actually a PhD. As far as our practice model goes, we have what I would consider a collaborative practice model. It is an integrated patient care clinical practice model where our clinical pharmacists practice on oncology disease teams, assisting with medication selection, treatment plans, order verification, education to both staff and to patients. And we have highly trained pharmacy technicians that handle and manage our distribution logistics. As far as our drug expense, we have about a $200 million drug budget. As far as our volume goes, we compound about 600 to 650 chemotherapy infusions and injections per day throughout our system, which we've really seen about a 20% increase over the previous year, and we continue to see an increase as our patient population continues to grow. So what are the challenges that we're faced with? If I was to list challenges that we are faced with on a regular basis, clearly one of the ones is a large academic center and a large infusion program. We're faced with the challenges of compounding as it relates to meeting the regulatory standards of USP 797 and USP 800. We've spent the last year upgrading our clean rooms, and we've been very successful in doing that. I'm very proud to say that all of our clean rooms now are USP 800 compliant. Clearly, finding qualified and trained oncology staff, it continues to be a challenge. Even though we have our own training program through our PGY2 residency program, we're constantly looking for qualified oncology trained pharmacists. Increasing drug costs obviously is something that we're always concerned with. We're seeing tremendous increases in expenses. For this next year's budget, we're looking at a 10% increase overall. We're being challenged with new therapies such as CAR T therapies. And the need to provide patient support through our continuously increasing medication assistance program is something that we're proud to say that over the Last 12 months, we provided support in excess of $12 million to patients within our system. So why did we join NCODA? I'll tell you honestly, we felt that NCODA is addressing an area that is in dire need, which is oral chemotherapy. As an academic medical center, we recognized probably about 4 years ago that we didn't do a very good job when patients were discharged from the hospital. And we spent a tremendous amount of time building an infrastructure to support those patients, or I should say ongoing support of those patients when they left the hospital. As it relates to adherence to the oral chemotherapy medications and ongoing monitoring for toxicities. Why do we like NCODA? One of the things I've noticed about NCODA is that we are always looking for ways to increase the knowledge of our staff. I think the network of systems that are within NCODA is very nice. We're continuously looking at ways to increase involvement of our pharmacist staff, our technician staff, and a supportive staff. And I feel that NCODA is a unique organization that provides us that opportunity. I think I'll stop right there. I think that gives you a good overview of our program, and I thank you for the opportunity for letting us share this with you.
Thanks so much, Howard. And if anyone has any questions, we can certainly open the floor. But Howard,
Sure.
Sam, we appreciate your time and that overview of Smilow Cancer. For everyone else out there, if you'd like to be featured as our Practice in Focus, please feel free to visit the NCODA website. Practice in Focus does have its own page where Smilow will be featured for this month, as well as our previous practices. And if you and your medically integrated team would like to be a part of that, please feel free to submit an application, and we'd be happy to review that. So, gentlemen, thank you again, and we really appreciate that.